You're welcome back to the show. This is still iBrandTV week on a beautiful Thursday morning. It's time for the health discussion. Right now we have with us for this discussion Dr. Benjamin Olowo-Jebutu, the founder of and executive director of Benjamin Olowo-Jebutu Foundation. Good morning, Dr. Benjamin.
Good morning to you. How are you doing today?
Fine, thank you.
You're welcome to the show.
Thank you very much for having me.
All right, now we're discussing fibroid. Now, fibroid is a non-cancerous growth into uterus that develops during a woman's childbearing years. Like I said, we already have, I've already mentioned that we have a doctor in the studio, and he was going to help us enlighten the possible causes, symptoms, and preventive measures we can take just to avoid having to go through the stress of fibroid. Dr. Benjamin, it's back to you. Now, the topic fibroid, it's seen is more like on the lips of almost every woman. What's the percentage like of those who have fibroid in maybe Nigeria, Africa, and the world?
So, fibroid is, as I've said, a non-cancerous tumor.
Oh, okay.
Benign, that grows in the woman's uterus, womb, basically, for laymen. So, it's now in Nigeria, Africa is 3 out of every 10 women has fibroids, and it's increasing now because people say use of contraceptives, late marriages. A lot of women are looking for the tall, dark, and handsome men. They're not getting married on time. Those things allow the fibroid to grow because normally the womb should not be fallow. Something must grow in the womb. That's what scientists say. So the longer the womb stays fallow, the hormones that stimulate the fibroids to grow will work more and fibroid to grow in the woman. So we say average between 30 and 35 years old people in Africa has the ability to develop fibroid. But now it's coming younger. I've seen patients less than 25 having fibroids now. It's very, 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 very common now. It's peculiar to Africa. African Americans, Africans. We will not say it's a genetic mutation or something, but peculiarity of these fibroids are found in African people. Maybe because, I don't know. People say because we are black. I don't know why.
Is it because of weather factor? Or?
It's not weather anything. There's no factor that's linked it with any gene, any race, but because of the years and because of the amount of fibroids we see them more in black people, more in black Americans, more in black Asians, black people. So we've not been able to decipher if there's any correlation between their genetic mutation, their genetic configuration with the fibroid. We know that it's more common in black people, basically.
Yes, you've mentioned certain age range.
Yes.
I want to further probe to know what age is most susceptible to this very. Is it a disease?
So it's a disease. It's a disease ravaging women. I call them monsters because when you see the symptoms, you'll be amazed how some women cope. It's a lot of work, a lot of stress. So what are the symptoms of this fibroids? But basically it happens between 30 and 35 age.
Okay. 30
and 35. That's most times we see the fibroids. Then it can go beyond that time. But now I said things are changing. Too many, westernized food. Too many things are happening to us in Africa, and it's happening less than those years. But in the back in the days, 30 to 35 have it. So I give a small scenario. What I've come to think that is one of the causes of fibroids. We don't know the causes. One of the predisposing factors that can make you have fibroids. So look at it for me. If you start menstruating at 11 years old and you're 40.
Come again?
If you started menstruating as a woman.
Okay.
At 11 years old and you're now 40 years old.
All right.
Unmarried, no pregnancy. That means you've menstruated for 29 years of your life without a break. You agree with me? Because 40 minus 11 is 29. So imagine you menstruate every month for 29 good years without a break. The womb cannot be that fallow for that long. Something must grow in the womb. Then the fibroid will develop. Well, our parents didn't have fibroid. When they have fibroid? Because they got married earlier and they had multiple children. So when you're pregnant, 1 year you carry the baby, no menstruation. So the womb is what is relaxed. The hormones are just relaxed. Then another 1 year you breastfeed, that's 2 years. So 2 years of not menstruating reduces the capacity of the womb to produce the fibroid. But imagine you shed blood every month, every year, year in, year out, for 29 good years, the fibroid will have to grow because that womb can't be that empty for that long. That's one of the predisposing factors. So I usually advise women, early marriages, get pregnant early and just sort out your family quickly. It reduces the capacity of the womb to produce the fibroid. There are people that are very obese, obesity. One of the predisposing factors is because the hormones that help the fibroid grow, they are fat-soluble hormones. So when you get big, you stimulate the hormones to stimulate the womb to produce fibroids. Then 3 weeks in the family. So family history. So your father, your auntie had fibroids, or your auntie's auntie had fibroid, your family had fibroid. It's also a possible lineage that you also have what fibroid because it's in your family lineage, that kind of thing. So, and also radical use of contraceptives. That means you're stimulating the womb to produce a lot of hormones, can also what predispose to having fibroid. So those things are what we call predisposing factors to having fibroid. And as women, we have to mitigate against them. One of the things you have to do is to be open, ask questions. If you have the symptoms, see a doctor to get a scan done to be sure to know the symptoms early. What are the symptoms? So look at it, sir. You have somebody that menstruates before 3 days a week.
Okay.
Normal flow.
A month, you mean?
A female, yes, a female. So you mentioned
a female. Does it also happen?
No, it doesn't. No, you said 3 times a week. I was correcting it to month or
yes,
it's
no,
week.
okay. Yes, no. So I mean 3 days in a month.
In a month, yeah.
3 days a month. So
okay.
first day, second day, third day, normal stuff. That's how you menstruate every month, 3 days, and suddenly the 3 days becomes 5 days, and it's now heavier. So instead of using 1 part per day, start using 3-4 parts per day. Some go to 7 parts per day. Some now bleed for 12 days a month, 12 days in a month, regularly. Now, because of that drastic change in menstrual flow, is a pointer that you call menorrhagia. Menorrhagia means excessive blood loss during menstruation. Menorrhagia. Menorrhagia. So you are menstruating and you are bleeding heavier. That's menorrhagia. That's one of the symptoms of fibroid. 2, your abdominal gate begins to grow. So you used to wear a size 15 skirt before. Now, suddenly, that 15 size cannot take you again. You now move to 18. It's not food, it's not eba, it's not abala. Something is growing in the womb. So you have to go and check it out. I get to my point. Now, you're now having pain. The pain during your menstrual flow is now heavier. Is crazy. You can't even bear it again. We call that one dysmenorrhea. That's pain during menses. That pain, because of the fibroid, and because the fibroid is a mass in the womb, it becomes more severe. Then you should check it out. That's the fibroid symptom. Then because people now bleed excessively, they become fainting. They become pale. They become lethargic. So somebody that can climb a staircase in 2 minutes before, now waiting to climb the stairs 20 minutes, and it's panting because they are losing a lot of blood. Severe anemia. So those symptoms, you see them in women at that particular age range, you must look out for what uterine fibroid. So that's how to diagnose and get those symptoms sorted. Then you now look at what types are the fibroids. Fibroids usually are located are named around a location, which means in the womb. Where are they located? I get to my point. So you have submucous fibroid, you have intramural fibroid, you have pedunculated fibroid, and you have subserous fibroid. I'll take it one after the other.
Beautiful.
So you have submucous fibroid. Submucous meaning fibroid growing in the wall of the uterus. Submucous in the wall. So that one causes a lot of pain because when the muscles stretch, then there's severe pain because there's a stone. There's like a mass in the muscle of the womb. So there's severe pain in submucous fibroid. You now have intramural. Intramural means inside, in between the endometrium, where the baby should stay. That's where the fibroid stays. That's one of the major causes of habitual abortion. So you have a fibroid staying where the baby should stay. So instead of the fibroid, instead of baby staying there, what happens? The fibroid pushes the baby away. So you see why we say they say that I was 2 months pregnant and as I seen blood, it's because there's a fibroid that is taking the place of the baby. So see, think about it in your mind now, sir. In your mind, you have like a bean seed, a bean or a granite seed fighting against a coconut, a hard coconut.
Yeah.
Which one is coconut?
Coconut is the fibroid.
Wow.
The bean seed is the baby.
The baby, yeah.
The fetus.
So, yeah, the fetus, yeah. So
Wow.
the fetus, see, no matter how much the fetus wants to expand or grow, what happens? There's a stone, the coconut, that will push down the baby. So you see, without having intramural fibroid, having a lot of habitual abortions. So you have subserous fibroids. So these are fibroids that are outside the womb, just on the wall, outside the womb, on the wall. Most people that, if you're lucky, if it's a very small subserous fibroid, they get pregnant with it because it's outside the womb. But if it's very big, the weight of the fibroid will also cause what? An abortion for the baby.
All right. So before you continue, we have some questions on our live chat.
Okay, go ahead.
So someone is saying, thank you for treating this topic. My mom had fibroids some years back that lasted for 4 years. It was not a good experience at all. The mistake we made was waiting for a miracle. She was just getting skinny at the end. We had to operate it. Now someone else is saying, what does the option of removing the womb comes up doing operations of fibroid? Now I have so much question, but I'll just take this one first, the way you respond to this. So the next question is, the first person said the mistake they made was waiting for a miracle at the end.
So a lot of people, and I think it's African mentality, is the Nigerian thing. People use your fears to create money for themselves, or use your psyche, your fear. So a lot of people in Nigeria have taken these herbal medicines as a business to manipulate people's mind and take them away from surgery on time. So they tell you, I have a drug that will shrink the fibroids, that will make you pass the fibroid away. You go to the bathroom and you just pull the fibroid out. Those fallacies, those lies make people keep waiting and taking those medicines where they waste a lot of money on. That never works. So those herbal medicines cannot shrink the fibroid.
But a lot of people keep gravitating towards this, meaning it's working for others.
It is not working for
It's like a referral thing.
No.
When an individual goes there, gets treated, the individual spreads the good news, and others would want to go there to also.
So let me tell you how they do it. It's all charade of psyche. In Nigeria, that's what it's people's psyche. You tell them they're going to die if they do surgery. Tell them they're going to take it their home if they do surgery. They won't make it. So, because that's what the patients want to hear, I can tell you can tell them that false declaration. They will believe you because they are afraid. You've got that fear into them. But I tell you one thing, because we've done over 5,000 surgeries, and I realize that people that have this mass grow are those that have taken numerous herbal medicines, telling them it will shrink this, it should shrink. They pay this amount of money, it should shrink that amount of money until the fibroids start affecting their quality of life. Let me tell you one story. Somebody had big fibroid, huge enough that had pressed on her bladder and her kidneys. So instead of urine coming from the bladder, from the kidney to the bladder, it was going back into the kidney. Reflux, hydronephrosis. Then they started looking for help. So most people, because of the naivety and the lack of love, people just work a lot on their fear and make money of them. Nobody will come and tell you today that they've taken about medicine and they passed out something. They're all lying.
All right, now the next question, so if you don't forget, says the person is asked, when does the option of removing the womb comes up during operation of fibroid?
So there's what we call a hysterectomy. Hysterectomy means removing the womb. Mammectomy means removing the fibroid. So if, for example, you've made all your family, you're complete. You have 3 children, you have 5 children, you're okay, and you're not still having this huge fibroid affecting your quality of life, then you are advised that since you don't need the womb to carry any baby anymore, you take it out. That's a hysterectomy. So that's where the point of hysterectomy comes in. Another point is that when the fibroid is now causing you a lot of harm or resting on other things, intestinal obstruction. That means you want to go to the bathroom, you cannot poo, you're severely constipated every time, you can't even pee. Those other related symptoms they can give you the advice of either taking out the womb, because if you leave the womb there, it might cause other problems in your general body.
All right, next question. Yeah, a lot of questions are coming in, but then this next one is saying, can fibroid regrow after he has once been operated?
Yes, it can. It can. So what I advise people that when you take out your fibroid, you get pregnant. When you get pregnant, that space or that opportunity for the womb to grow another fibroid is reduced because you're pregnant. There's something the womb
occupying the space.
Occupying the space,
yeah.
so it won't grow again. So and also the study is done properly. Every fibroid is taken away because it's like a seed. That's how it starts from a small bean. It keeps growing as you eat food, as you feed on the fibroid. So every fibroid that you see that is 36 feet, that is very, very massive, started from a seed. As you feed food, as you eat food, you feed on the fibroid like a baby in the womb. A baby comes from a seed, they become a fetus, an embryo, then they become a fetus, then becomes the baby you see. That's how big the fibroid can. And because the womb is very expansible, it's very, very elastic, it can grow as big as 2 basketballs, 3 melons, because I've seen many 20 kg, 19 kg.
And it feels like, makes the lady feels like she's pregnant.
She's pregnant,
pregnant
So they call them yabeji, they call them also the yaijima. A lot of them are very, very, they feel very, very bad about it because they can't go out. So you're depressed, you're depressed, you can't do what you want to do, you can't wear the kind of clothes you want to wear, you're not happy. Those things cause them depression and everything, And no man will see a woman with that kind of tummy that says wants to marry because to them they think you're already married.
Yeah, I'm pregnant.
Yeah, so it's important we seek help early, then we cannot begin to get help on time.
All right, I'll just take I missed so many questions. Just take this one for now. It says, when is the recommended time for childbearing, just to avoid this hazard of?
So people say there are 4 stages of childbearing. 21 to 25, the best time.
So if we are more than 25,
I mean, the best time. That's the best reproductive age.
From 21.
25 to 25. Then 25 to 30, it drops a bit. So it's not from 25 to 30 is not as effective or as magnifying than 29 to 25, but it's still good. 30 to 35 too, the clock goes down a little bit. Where we advise that between 20 and 35 is the best childbearing age. After 35, the woman is also prone to having children with what we call abnormalities, the Down syndromes, the Turner syndromes, the Edwards syndromes, the Pattern syndromes.
Wow.
So we usually advise, and we don't say it's all like compulsory, everybody has it. They are prone to having those kind of complication after 35, but between 21 and 35 is suitable year to have children.
But for in a case where a woman who is not married, you mentioned that the womb cannot be empty for a while. Someone who is not married probably gotten pregnant before, or maybe had an abortion, and or maybe lost the child or have the child, and still is there a possibility of having fibroid even as maybe you've got pregnant before, maybe had an abortion?
Yes, you can. It depends on the length of weight. So look at our parents. Imagine our parents in the village. They had maybe 10 children, almost immediately. So every year they're pregnant. So you have maybe a mother was like 19 or 20, 21st child, 21st child, 21st child, then another child. So they have like 5 of them. So imagine 5 children times 2, that's 10 years. So 10 years of their life, the womb is just relaxed because they're carrying the baby 1 year, they are breastfeeding the baby the other year, but the next year again they're carrying another baby, they're breastfeeding another baby. So the womb is relaxed. But a woman that has a baby, maybe when she was 12, or maybe when she was 20, and there's not a lot of space, and I'm waiting for the other baby when she's 35. That's already 15 years again. So that womb can't be that follow that long if fibroid can grow in the womb.
Now, Benjamin Olowojebutu Foundation, which you are the founder,
yes,
has been doing, has been doing a lot of commendable job in the area of healthcare.
Thank you.
Very briefly, first of all, congratulations.
Thank you very much.
For those of us who do not know much about this, very briefly, tell us more.
Okay, so in 2016 I had an accident. I was on my way home and this drunken driver ran into my car and broke my right leg in 3 places. I was rushed to a big hospital in Lagos and I was left on the floor for 5 hours. Nobody attended to me as a doctor. You know, then I was almost passing out. You know, I got this inspiration that I must turn my pain into passion. That I was sent. This is the purpose I was sent to the world to do help women in Nigeria and Africa. So that's how we started the foundation.
A prophecy, you mean?
No, an inspiration.
Okay.
So it was just clear that if I as a doctor can be on the floor for 5 hours, nobody attended to me. What happens to other people that are not doctors, you know?
Well,
So yeah, so we started a foundation with that. I went for my first outreach in Benue with my team, with my 2 crutches, just to obey the assignment, you know. And it's been fulfilling, helping women that can't access help, can't afford help, that cannot that they are destined to die because before God they can't do that. We've been to 15 states in Nigeria. And it's been very fun. It's very impactful.
All right, that's
Thank you very much.
Amazing one. Thank you so much, Dr. Benjamin.
Keep up the good work.
Yeah, keep up. We are proud of you. Yeah.
Thank you very much for having me.
All right, thank you. That was Dr. Benjamin Olowo-Jebutu, founder and director of Benjamin Olowo-Jebutu Foundation. You heard all he said about fibroids, and if you have more questions, please find it pleasurable to send it to our social media platforms and also the live chat below. Dr. Benjamin would reach out to him and he will answer your questions as quick as possible.